Hi, I'm Dr. Charles Shinaver. Welcome to Fit Families TV. Today we're going to continue to talk with Ashley, who's a college student. And last time we were talking about the abuse of ADHD medications. I wanted to see if Ashley had anything else to say about that today.
I do. Last week I was working on studying for an exam with some of my friends, and one of my friends asked another friend, we were talking about how it's hard to concentrate and study for a few hours for a big exam, and it's just really hard on us as students. And one of them, he goes, yeah, how do I get prescribed for an ADHD, medication? How do I get prescribed for ADHD or diagnosed? And my friend, Kate, turned to him and said, oh, it's really easy. You just go to your physician and you just tell him, I'm anxious, I'm nervous, I can't concentrate, and I have a really hard time studying. I think I need an ADHD med, and he'll prescribe it for you. And I just was astounded. And I think it's really good and fitting that we're talking about this because it really is real, and it really is a big deal on college campuses that there's a huge problem with abuse of ADHD drugs.
Wow. Yeah, what a story. So let's talk about when people are accurately diagnosed with ADHD, so a little different category, and they're correctly prescribed with that medication. My concern is, do students really know what they're getting into in that type of situation? So what's your point of view about that? Do they really know what they're getting into when they're diagnosed and they're prescribed and they start taking this medication?
I don't think so, because to me, through talking with my friends about this and asking them questions, what is it like to take an ADHD med? It seems like an experiment to me, because multiple friends of mine have said that they've been on several ADHD meds, like Concerta, Strattera, and Adderall being like the three main ones. And to me, it sounds like an experiment. It's like the doctor prescribes you medication and to see if it's going to work out for you and if the side effects aren't so bad. You start to take it, and within the first 3 weeks, you're nauseous all the time, you're throwing up, and you have really bad headaches. So you decide not to take it. So then you move on to the second medication that the doctor prescribes for you. And then every time you have something to eat, it doesn't taste good, or it's unappetizing, or again, you feel sick, and the side effects just are unbearable. So you stop taking that, and then you get prescribed a third medication. And to me, it goes on. It just continues until you find something that maybe doesn't have the worst side effects. And if something's supposed to be so positive for you, how come it takes such a long time to get to the right medication? Even still, when you get to that right medication, you still have to deal with the side effects. And it's really just disheartening to me that that's kind of what we've come to depend on pills, that there has to be something else out there that doesn't have all those side effects and that can be as beneficial as an ADHD med is, thought to be.
Absolutely. I actually call that the side effect shuffle, because you try one medication, you have a bunch of side effects, tolerate for a while, and then you want to shuffle. So you try another medication, you have new side effects, and you kind of keep going in this process, and it's kind of confusing. Where does it end? I mean, do you have any friends who kind of keep dealing with the side effect shuffle?
I do. One of my friends took Anna. She took Strattera and she took Concerta, and after trying both of them for a total of like 8 months, between the two, she just couldn't take any of them anymore. One of my other friends, Jill, she told me when I asked her what she took, she said, oh, I take an amphetamine. And I quietly but internally was just kind of freaked out, like, you're on an amphetamine? Like, that sounds really illegal, And so I didn't want to bother her about it, so I Google searched it and just looked at the first thing that came up, and it said that, amphetamine is really closely related to methamphetamine, which a lot of us know is a highly illegal and potent drug that deals with hormones. So that's where, the amphetamine helps with hormones as well, and dealing with ADHD and with inattention, and helps you be more attentive. But it just astounded me that she didn't really react to it. She was just like, oh, I'm on an amphetamine, and like it was something normal. And that kind of bothered me as well, because it's really close to being something that's really dangerous and very illegal.
Absolutely. I mean, to me, it highlights the need for what other options do we have where instead of just taking a pill and now you pay attention, but how can you develop a skill, or how do you work in some way to develop attention and increase your capacity for attention, as opposed to relying on a pill, and when the pill wears off, your ability to pay attention goes away. So it just seems to highlight the need, in my mind, for, again, alternatives to increasing attention. So thank you for watching Fit Families TV. This is Dr. Charles Shinaver.